This story comes from commondreams.org. Big Pharma has raised drug prices 1,186 times this year, according to a recent analysis. So want to talk about, like, kind of just in general, too, the insane corporate price gouging. We're in this place where everybody wants to talk about inflation. They want to talk, and it's legit, right? Because inflation is hurting all of our livelihoods. It's changing. The money you have is worth less, significantly less than it was worth just a handful of months ago.
Sure.
That's legitimate. I get that. But what is not legitimate is saying that we have an inflationary problem when companies like Exxon post a $16 billion quarterly profit that is double the profit of their prior year. That's fucking insane.
Right.
It is not inflation when drug companies whose costs have not increase the cost of these drugs. And it is also insane that here we are as Americans paying the highest drug prices in the entire world and continuing to eat shit on life-saving medications where people are forced to choose between being well and paying their rent or eating food.
And it's because of our terrible system for paying for drugs.
Yes. Yep.
Right? You can blame this. You can lay this all on the shoulders of this fucking hyperloop system that we have that tunes itself up to make it so that we are basically fucked. We are basically fucked by our the insurance companies. They're gonna be the ones that are dealing with this stuff. But the only place in the world where the prices are negotiated for this sort of thing is us.
Yeah.
I mean, I'm sure they're negotiated in some way, but they're like, it's a big deal when an entire nation looks at you and says, we're willing to pay this. That's a big difference between one insurance company that's saying you just have bigger leverage. This is why unions, big, wide union-wide strikes work over one worker quitting. That's why it works. It's because you have more bargaining power the larger your organization is. And so we don't have that sort of thing here in the country. We have several little insurance companies that vie for this sort of thing. And they pluck all the money they can from us, and they are still making a profit, even though these other companies are making a profit too.
Everybody's stacking. The problem with the profit motive at every level of healthcare is everybody is stacking profit at every level of your care. So the doctor has to make a profit. The doctor's office has to make a profit. The drug company has to make a profit. The pharmacy has to make a profit. The insurance company, everybody's, and I don't begrudge the individual company for existing to make a profit. That is what companies do. So I don't want to sound like I'm begrudging a doctor for making a living and feeding their family. I don't. And I know that they have costs to pay and educational costs, all of which are structurally problematic. The whole problem is that this is structurally problematic. The largest payer, or the largest payer for medical claims in this country is Medicare. And the Biden administration is trying to pass a bill which would allow Medicare to negotiate drug prices that they then would have to offer to every other insurance company, because they've got the leverage, because they are the largest. They're essentially the largest insurance company in the country, right? And so, but we don't even have that leverage.
Right.
We have the leverage to say, look, if you want Medicare to buy drugs from you, you got to sell them to me for this dollar amount, and you got to sell them to everybody else for the same dollar amount.
Yeah.
The thing is that, like, none of that is the truth. If I go to the pharmacy and you go to the pharmacy, you and I have different insurance. If I get the same drug as you and I will pay different prices. People in other countries, and that's just normal for us, right? That's just something, because my insurance coverage might be different than yours, and my insurance company might pay a different amount than your insurance company, and then I might pay. The drugs don't even cost the same person to person.
Right. It's not like
it's
candy
insane.
bar. Like you walk into or whatever it is. Like let's pick something big. A PS5, if you're not buying it from like a fucking back door somewhere,
buying an eBay
or
from
something,
some scammer,
if you're buying it from an actual company, it is always the $599.99 or whatever, right? It's, I don't know how much it is. Don't send me a message. I don't care. I don't know. Yeah. But I'm just saying, like, it's always that X dollar, and it's always, and that's why, like, you can go to Amazon and get it, you can go to Best Buy and get it, you can go to mom and pop store and get it, you can go to all these other places. It's always the same price.
Right.
So different than what we do with drugs, which is it can be $9.99 for me, and it can be $70 for you.
Yep. Yeah.
It's just a totally, and they're talking too about companies that have been making money because of the pandemic, right? They're making a shit ton of money.
Hand over fist
because of that.
Yeah.
And they're still making tons and tons and tons of money outside of this. And then it doesn't, there's no stopping this. There is no stopping this until we change how we deal with this. Now it's either, and there's a bipartisan bill, supposedly, that has enough support that can get passed and basically regulate these prices. And I suspect it would regulate them for like what Medicare pays or something.
Right.
You know, it would probably regulate them based on that. But we spend way too much on this stuff, and these companies, they know it, and they know they can get rich off of it.
Oh, absolutely.
And they don't care.
Yep. They do not care. And the excuse that you hear from defenders of pharmaceutical companies all the time is that, they got to charge all this money because they've got to do this R&D. And I just want to say that is the biggest line of bullshit. We've talked about this before.
Yeah,
it's the biggest line of bullshit. The NIH, the National Institute of Health, funds most basic research. Most of the preliminary basic research is government funded. A lot of the other research is funded from universities, who then turn around and provide that, often at no cost, to drug companies. They're handing them a nearly finished product. The majority, when you look at the breakdown in spending, the majority of spending from pharmaceutical companies is not R&D. It's fucking marketing.
Yeah.
Most of the money that goes out their door is not involved in coming up with the next big blockbuster drug. Your taxpayers' dollars already funded that. They funded it through NIH grants.
Yeah.
You're already paid for it, and then we gave it away to somebody to charge us for it.
If that's where the money's going, then why aren't the scientists making more than the CEO?
Right. Right.
That's where your money's going.
Right.
Why aren't they making more money? You know, that's the case.
Who would you rather be financially? Would you rather be a pharmaceutical sales rep or a pharmaceutical research guy?
Yeah. Yeah. Answer that question.
Right.
Yeah. Answer that question and see where you think.
Who's W2 flexes?
Exactly. Yeah.